Welcome. This is Attorney Talib Kareem, and I am honored to be with you today for a town hall conversation. A town hall conversation featuring some of the nation's top education and health leaders. And I think that it is without question that on the top of everybody's mind is the safety of our children in our schools, both in our K through 12 schools as well as in our colleges. And with every day, there's an announcement about a school shutting down because of COVID, or a school shooting, or a school incident of violence. Of course, this is happening every day in the Washington, D.C. area, but it is a national pandemic, a pandemic both of the COVID virus itself as well as the virus and pandemic of violence taking place in our school. And so we have to come up with some solutions. We have to give the parents, give our educators a playbook. We have to put our hands around our children and make sure that they are not either being victimized or being victimizers. And of course, we know about the violence that is taking place outside of our schools every single day in every city of America. And this is definitely something that we plan to talk about and hopefully come up with solutions today. And so without any further ado, let me bring on and introduce our distinguished panel. But before doing so, I would be remiss if I did not take a moment to at least acknowledge our sponsors. And those sponsors are the Virginia State University, the office, actually not just the office, but the Lieutenant Governor-elect Winsome Sears, Tommy Thompson with InecTech, the W. Montague Cobb National Medical Association Health Institute, the National Bar Association Health Law Section, and Abe Yoga. We want to ask everyone to check out the websites for those organizations. They're going to be also listed throughout the evening, and you're going to have an opportunity to become more familiar with those great organizations. So without any further ado, let me go on and bring on our guests. We, first of all, want to bring on from Virginia State, Dr. Robert Corley. Dr. Corley, thank you and welcome.
Thank you so much. I just wanted to give greetings to our fellow panelists, our Lieutenant Governor, Winsome Sears. We appreciate her for her service. Our fellow panelists, Winston Price, Attorney Frazier, and Dr. Makeda Bay.
Excellent. Well, let's make sure we can bring up on those people who you just mentioned. Without any further ado, let's bring on Dr. Winston Price. Dr. Price, welcome to the conversation.
Thank you. Welcome.
Another one of our partners and speakers is Attorney Cherise Frazier, the chairwoman of the National Bar Association's Health Law Section. Oftentimes we say NBA. People think, oh, the National Bar Association, the National Basketball Association has a health law section. And of course, they need to have a health law section with so many people who are getting COVID, who are playing basketball every single day, but not to be confused with the National Basketball Association. This is the National Bar Association's health law section. Welcome, Cherise.
Good afternoon and welcome.
And also, I want to bring onto the conversation Dr. Makeda Bay, a expert in mental health, and one of our, I believe, voices that needs to be heard more, because as we talk about the health crises in our community, not enough attention is being paid to the mental health element. Welcome, Dr. Makeda Bay.
Thank you for having me.
So, and again, our Lieutenant Governor was on, and we're hopeful that she will be back on. I know she was in commute, and so perhaps she has a Wi-Fi issue of some sort, but we're looking forward to having her back. But let's just go straight into our questions. Let me just ask you, I'm sure that you guys are familiar with the spate of violence that is taking place every single day in our schools, as well as the increasing incidence of COVID and of sickness taking place in our school. I see that the Lieutenant Governor is back. Welcome, Lieutenant Governor-elect Winsome Sears. How are you doing?
I'm doing fine. I thought I was on this whole time. I was waiting on you. But
Well, we're glad that you are back with us. And again, we want to express our appreciation for you and your office's generosity in supporting this conversation today. So first question is I'm going to ask to every one of you all, in the context of what we see, the dual pandemics of both the COVID variants, the COVID, virus itself, and it's all of its variants, the Delta variants, now the Omicron variants, as well as violence. How has this impacted either your campus, in the case of Virginia State University, or the communities around the schools that you are connected to? I'm sure that we all are connected some way to schools across our country. Why don't we start first with you, Lieutenant Governor? How has this impacted the schools of Virginia in particular? Lieutenant Governor, can you hear us? Okay, Lieutenant Governor, can you hear us?
I'm thinking I'm on. Can you hear me now?
Yes, we can hear you.
Hello?
Yes, ma'am, we can hear you.
Okay.
Go ahead.
So I'm driving, but I'm driving, so I'm not driving, I'm a passenger. But my connection has been spotted, so I'm not sure you all said. I don't know what was said.
Okay, so what we were saying,
in and out.
no worries. What we were asking is, what do you believe is been the impact of the both COVID pandemic as well as the pandemic of violence on the students in the schools of Virginia? Can you speak to that?
Okay, so you're going in and out again, but I'm just going to take a stab at this. As I was campaigning throughout Virginia, I found so much disparity, and we know disparity already existed, but COVID has exacerbated that. For example, in Lynchburg, I was told by a gentleman, I won't tell you his title, he asked me not to mention that, percent of the children in Lynchburg never signed on, not one time, 40% during the COVID cycle in the public schools, not one time. And then of those who did sign on, I think he said 70 or 80% of them have failed. Now in Lynchburg they're just going to socially promote them. So they've really lost 18 months of instruction. Then I'm hearing from others who they're wearing the masks in the schools, and especially in the younger generation, the younger population, they can't speak properly, and the teachers can't see their mouths so that they can ensure that they're forming the words properly, and it's just a mess. And I'm hearing elsewhere that the children are just not learning. They have really lost some time. I guess they're calling them the COVID generation. Now, I have been to private schools, and private schools have been open 5 days per week for the past 18 months. And so I said to one of the schools, the headmaster, I said, well, did the COVID not come here at all? And he let me know. They have had cases of COVID, but they just sent the children home. They followed CDC guidelines and sent the children home. And it was fine. They had no problems because they said if they closed, they would have closed for good. And so they could not afford it. He said, we're not paid to keep the children out of school. And I've heard from parents who, and I don't want to monopolize the question, but I've heard from parents I found this very interesting. One parent, she had a child in private school and another child in public school. And public school was not open, so she had to remain home with that child. And the other child who was in private school went to school every day. And she said there's got to be some kind of a workaround that could have effectuated my child who goes to public school, you know, uh, in school. And we know now that quite a few parents have decided to move their children from public school to private school for that very reason. So something's got to give, because our children aren't learning, and it's getting even worse. So I'm really on this panel to learn more about what's going on and how I can help, because you all are the experts in this area, and we need your guidance and your advice.
Well, I appreciate that. And you brought up a lot of interesting points. And you mentioned how the disparities have really impacted educational facilities. And I think it would be appropriate at this point to bring on Dr. Robert Corley, who's with one of our Virginia's leading educational facilities, who is in the business of training teachers who are going to be going into our schools, both our public and our private schools, both in Virginia as well as across the country. Dr. Corley, how have you guys there, confronted those issues with, both the mask requirements, with the vaccinations, and of course, keeping your children and keeping your students, even though we consider all of even our college age, youth and students, our children, especially if we're paying for them to go to college, they are definitely our children. But how do we keep our students and are safe, and how are you all doing that at Virginia State University?
So thank you for that, and thank you for the question. We started this year off with a saying, came from 2 Timothy verses 1-7. It said that God did not give us a spirit of fear, but rather one of power, one of love, and one of sound mind. And we took that to mean that meant that we needed to have layers in place, a mitigation strategy that could protect not just our faculty, but our staff and our students and those folks living at our campus. And so we did that. We adapted a concept of one band, one sound. That meant our philosophy was that we did wear masks. We did have a certain cleaning protocol. We did depopulate when necessary. We had weekly testing of our exempt individuals. And we did have a vaccine mandate. We also had very specific quarantine and isolation procedures. And to give you an idea of how that manifested, after a whole semester, we had only 34 cases of COVID. I say that again, we ran over 10,000 tests and we only had 34 cases of COVID. And so my hat goes off to, I guess, us as an institution, because that required a lot of commitment. It required our strategy to both have incentives to educate folks, but to build a community of individuals who believe that, one, we could still mingle, we could still have face-to-face instruction, we could still have a high level of engagement. But if we did it in such a way, we could still maintain the level of safety that's necessary for our campus. I also want to just piggyback on our Lieutenant Governor. COVID has done several things. It's really been the great revealer. Some people can talk about supply and demand. We saw incidents in the criminal justice system. We've seen, as the Lieutenant Governor just mentioned, incidents in our education system. But we've seen it in our health systems. We've seen it in our social services system. Even if you think about the fact right now that the number of orphans that we have, not just in Virginia, across America, because of COVID. And so as you think about those things that are holistic, when you think about how families and engagements, you think about how education plays in there, and you think about stability within a home, all of those things have been disrupted. Last thing I'll say on this question is Nelson Mandela said the best way to test the soul of a people is to see how they treat their children. Today, because of COVID, the mental health crisis that we had before has been exacerbated. And our ability to hone in and to provide the needs of those students who are going to be our future at this time, to recognize this moment, is going to be critical. So in addition to our mitigation strategies that we had, we were the first college in the nation, to my knowledge, to be proactive and have a mental health wellness day. We simply canceled classes. We had days, we had yoga, we had massages, we taught the kids coping skills, because we realized they had worked very hard to keep our positivity rate below 1% for the whole year. We also knew that they had the added stresses, the anxiety, the depression that was affiliated with COVID. And so, yes, we did it together. We did it as a group. We worked hand in hand with our local Department of Health and with our state Department of Health. And again, the artifact of that was we just had graduation today, face-to-face graduation. We finished the semester out with a positivity rate below 1%, and we were still able to provide authentic, transferable, and transformative learning experiences for our students.
Well, I think that is an amazing testament of the leadership that you all have with Dr. Mkola Abdullah and your other leadership team to keep your school safe and to continue to do your job of creating more outstanding professionals, both who are going to go into our Virginia schools as well as in our nation's schools, who are educators, as well as those moving into the cyber workforce. And as we speak about the cyber workforce, I want to bring in Dr. Winston Price, who is leading the issues of connecting both cyber to our nation's health system in the context of his role with the Cobb National Bar Association Health Institute. Dr. Price, how has the dual pandemics of both the COVID virus, and you are a pediatric specialist, I believe, by profession.
That's correct.
How has that dual pandemic of both the pandemic, the virus, if you will, COVID virus, connected and integrated with the violence to disrupt and cause problems to the educational process taking place there in the schools in Georgia, where you are based right now?
Right. Well, thank you, Talib, for having us. And the W. Montague Cobb NMA Health Institute is the research arm of the National Medical Association. And as such, we bathe ourselves in the evidence-based science and data-driven decisions with regard to healthcare intervention. That said, the Lieutenant Governor Sears and Dr. Corley brought up several important issues with respect to the impact of COVID-19. And what you heard time and again was data and science and the impact on our children in terms of the deficits in terms of learning. But what you heard from Dr. Corley was regarding the data with respect to what we can do and the facts in terms of mitigating the spread of COVID-19. That said, what's been happening, and it's a triple pandemic. It's also the social injustice and the racism and the impact on the social determinants of poor health outcomes that we've been dealing with before the pandemic, and has only been exacerbated as a result of the COVID-19 pandemic. That said, what's happening is the Lieutenant Governor is indeed correct. We need to continue to educate our children, and that's the best environment for them. But the fact that they don't get as sick doesn't mean that they don't get the virus and spread that virus and carry it home to vulnerable individuals, both in terms of the teachers, the school bus drivers, and their family and friends. And so the nearly 800,000 individuals who died as a result of the transmission of this virus, it's not something that we take lightly in terms of how that virus spread. And so while we want the kids to remain in school, unless they're following the science and the evidence-based protection and mitigation strategies that Dr. Crowley so well illustrated in terms of social distancing and mandating masks and keeping your mandates in terms of hand washing. If all of those elements were in place from the beginning of this pandemic through these 18 months, yes, we could have safely kept children in school. But we know that there's not fairness in this school system across our nation. And so children who are in schools that have poor ventilation, who don't have the same ability to social distance in their classrooms, are serving as reservoirs for continuing this virus and causing severe morbidity and mortality among our communities of color. And so that's what we're seeing. In Georgia, there's a wide range of success in terms of the charter schools that are able to remain in school and the municipal schools where children are from lower income families and lower income communities. And those children are not as safe in terms of the community. And so I too, as a pediatrician, want the kids to learn. I didn't want them to lose 18 months of learning. In rural communities where I practice, the Wi-Fi disparities of high-speed internet access has created even more disparity because they can't even get online. So we need a concerted effort, and we need to address the issues of disinformation and misinformation that persist even to today in these 18 months. And without that being corrected, we will struggle to get over this pandemic and bring equity to all of the children who need the education.
Now, you raised some very good points about the impact of COVID and how, while some, are afraid that we're losing time with our children going to remote education, their safety is paramount, more paramount than being face to face, which is, as you say, preferable in some cases. Although there's some data, and perhaps Dr. Bay can speak to this, that has shown that in some cases the educational outcomes of some of our students have improved. I know one thing that definitely dropped to zero was the amount of shootings in school during the remote education, the number of fights in school during remote education. And now it has gotten to a point where over 158 shootings, if I'm not mistaken, and that was at last count, and it has gone up sadly since that time, have taken place in our nation's school, including school mass shootings such as that which took place in Michigan, which claimed the lives of 4 high school students and also left others injured, including one educator. Some, parents, and again, we're talking about shootings. We're not talking about the number of assaults that are taking place. And in fact, there was an assault that took place here in Virginia with one Muslim girl being assaulted. And we want to talk about, this type of assault and these things that are taking place along with COVID. But let us hear from Attorney Fraser from the National Bar Association and how that's impacting. And I think you are based in Ohio. Is that correct, Attorney Fraser?
Indianapolis.
Indianapolis. Okay. In Midwest.
Yeah. So thanks, Talib, for, having this conversation. I think is very, very important. I think all the panelists have made very good points. A couple of things that I want to add to the conversation is that with the pandemic, there came a lot of fear amongst the kids, a lot of fear about what was going to happen to their parents, how successful they were going to be in school. And so that added a ton of stressors. And one of the things that was just kind of pointed out, and this is from a personal standpoint. So I have two twin nephews, and they live in the Dallas area, and they were completing their first grade year when the pandemic hit. And so they went out in the middle of first grade. They spent all of second grade at home doing remote learning. And then now they've gone back into the school in third grade. And as you've indicated, there's been a lot of fights and violence and just confrontations among the kids. And this is third grade, right? These are small kids. And one of the things that the counselor pointed out is that, well, these kids have missed a year and a half of social skills, right? And so they went from being first graders, learning how to be in school and interact with their classmates, to, over a year at home. And so now at third grade, they're really, really trying to relearn this. And we not only, from that personal level, but at the National Bar Association, we had a national COVID task force. And part of that was to make sure that we were doing our part to help, as we saw, kind of the reveal come out, right? And so we saw issues with not only our law students. When schools were shut down, it revealed that there were so many students who didn't have homes to go to. So when they were in school, that was their home. And when school closed down and they were required to go home, there was no home to go to. And so we took some initiatives to try to connect with those students at various different law schools across the country and to help get those students set up so that they would be able to continue remote school in some kind of way. We've also have an initiative where we are collecting laptops, and where we have partnered with Xfinity to make sure that we can get that Wi-Fi and those devices to students across the country, both law students and non-law students. And so what we have been seeing is that the stress of this pandemic, the stress of COVID, the stress of losing family members and loved ones, and just the mere fear of it has increased violence among our young people in a way that we really want to make sure that we're getting a handle on. I also think that, when you talk about education, those disparities are just there. But to Dr. Cobb's point, making sure that those mitigation practices are in place can help a ton. Again, from a personal standpoint, I have a 10-year-old daughter who she was able to go to school the entire time in person. However, they had very, very strict protocols, and it's a public school, it's not a private school. They had very, very strict protocols. They kept the kids in their little pods or cohorts or things. We made lunches if you could, and that allowed her to be in person every day, when I know lots of students were not able to be in person, but it didn't take away the anxiety that she was experiencing. So my husband and I have tried to be very in tune to the fact that there is a lot going on with the kids, and have tried to also help. And so some of the things from the Bar Association that we are still looking to do is how are ways that we can partner with our communities, because as you know, we're across the country as well. And so how can we partner with our communities to provide resources and support to help the kids stay in school and get that education, to also help them be safe. And sometimes that is looking at kind of what are the vulnerabilities of each of the various communities and schools that allow these unsafe practices to come into play. So there's a lot going on from the Bar Association with COVID. We hold very important conversation to have, and really want to step in and help in whatever way we can, and trying to eliminate some of the problems that's causing where we're at right now.
That's a great and very powerful observation, Attorney Fraser, and we want to say how we appreciate you. Dr. Bay, as we look at, again, the issue of the violence that is taking place, particularly in our schools. We recently, as you may have heard, had a sophomore student in one of our local Fairfax County high schools who was beaten up. And while being beaten up, her hijab, her covering of her hair, which is similar to what you're wearing, was removed. And there was, in her statement, no consequence for her classmates who did this horrible act to her. And this is something that pains her, and it is disrespectful from a religious standpoint. And every Muslim who, particularly every Muslim father who has a daughter like myself, who hears this type of assault, it pains them to think that this is what their children may have to face. Where do you think this kind of tendency of violence is coming from during the context of this pandemic, and what is the appropriate response when we hear these types of things from a mental health standpoint in particular?
Right. Well, first of all, thank you for having me. I think this is a great opportunity to discuss with the community some of these very important topics. And thanks STEM4US for creating such a distinguished panel. Yes, this topic is very concerning, and it's important for us to really see it for what it is. Those things like that happen because they are hate crimes, and they're things that we need to address as a community. And it's not just looking at the person who did the crime, but the community as a whole, and how we can how we play a part in that. I know for myself, I'm CEO of and founder of the Resilience Therapy Center, and we work with not only the inner city youth, but work with different people within the community, within the military, several different types of areas that really just hone in on and focus in on what's important to healthcare as a whole. And the communities that I work with and I deal with, they all have children. They all work in the system. They all work with the school systems. And it's important for them and for us to know that we need to be a part of everything that is going on within our community. So, for example, I have 2 children myself that are in the school systems, and they work hard to just be the best people that they can be. I myself, as a parent, know that it's my responsibility to make sure that they are representing themselves in the best way that they can, but I can't control other people's children. And it's really not up to the school systems either to do that. But there are certain things that can be put in place. I do like what Ms. Frazier was saying about being able to really connect with the community, what she's doing with the Bar Association, to make sure that there are programs and steps put in place to help in the community in that way. But things like that happening with that little girl, the situation was tragic and terrible, and needs to be put into the perspective of what it is. It's a hate crime, and it's those things that we need to address directly and in front of the school systems, with not just something that's an afterthought, but something that is really honed in on and made a part of our school systems to be taught, to be trained on, and not to be ignored. And that's really, really important.
From a mental health standpoint, Dr. Bay in particular, if we could stay with you.
Sure.
What are the stressors, and how is the pandemic causing this type of violence in our schools and outside of our schools? We heard, there was just some horrible news, that we're hearing of, for example, one man meeting some women on a dating app, and then killing them and putting them into some Target carts. And I don't even like to repeat the outlandishness of some of this, which is happening. But it seems to be happening at an increasing rate. And as we are going through this pandemic, and I don't necessarily know if this is happening outside the country as much as I hear this is happening here in America. Is this just an American problem? And if it is, or if it isn't, what do you think can be done to remedy, from a mental health standpoint, this type of outlandish behavior that is resulting in violence, manifesting in all kinds of ways across our country right now?
Okay, well, good points. Particularly when it comes to violence, violence doesn't just appear. Violence comes from something. It stems from something. And I see the pandemic as really, I think that it sounds like we're in three different pandemics. One is a viral pandemic, which we know, which is having to do with, the COVID-19 and the different variants that are apparently continuing to grow at this point. Another pandemic is the pandemic of social injustice and what it is that we're dealing with. And Black Lives Matter and other organizations and other efforts have been bringing to a forefront are the things that we as a nation and as a people really have put on the back burner. We knew that they're there. We know these issues are there, but we are not really focusing in on them. And from a mental health standpoint, we really need to recognize that, because what we do, so will our children do. So if we showing that we're going to be anxious, or we're going to be violent, or we're going to ignore things that are occurring, so will our children. So it's important for us to be the models that we need to be for them, so that they can be the best person that they can be growing up. Our jobs as parents, our jobs as a community, is for our children to be better than who we are, better than what we are. And if we're not doing our job, then that puts a great burden on the rest of them to be able to do the best that they can and to live through this world. And again, from a mental health standpoint, really that third part of the pandemic that I'm mentioning is the mental health status. My practice alone is booming, unfortunately, because of this lack of being able to connect with other people, that disconnect, that being unable to really just socialize with other people. I think again, Ms. Frazier mentioned that the psychosocial really the psychosocial skills that are being taken away from the kids in our schools is really damaging, and it's not really bringing them forward and making them build up, be better, be stronger, and be more resilient. And that's what we need right now. So what we can do from our part is, it always starts with the parents. It always starts with the people that are in front of the children before we get to the children. We are their examples, the very first examples in this world of who a good woman is, a good man, a good husband, friend, sister, brother. We are that. So we need to do better so that our children can be better than who we and what we are.
And Attorney Kareem, if I could just add real quickly to that. I would say that one of the things that we can do from, I guess, an institutional level, one, they say when you know more, you can do more. So we have to continue to educate ourselves in trauma-informed care. We have to help our folks understand how ACE, or adverse childhood experiences, impact the children that we are prepared to teach. And we have to create ways to help assist this. And this is, for example, at our institution, we have mental health ambassadors. So those are individuals who aren't simply in our counseling center, but there are other folks who have some level of training so that they can be present. A lot of times students need to know that someone is present with them. We've also made sure that the conversation is open. It's a very transparent conversation. Long gone is that day when mental health was something you didn't talk about. We talk about it all of the time, and we talk about the means, coping skills. We talk about it in such a way that it has taken away that negativity to a certain degree. It's still some there, but we've taken it away. And it really begins the first step, which is awareness. So awareness on us as faculty, staff, administrators, but also awareness as students. The more we explore and we share with them, the more they realize that not only do we have the services there, but that they're also in need of those services. And what that does do for us, by making that investment on the front end, it really helps us on the back end to prevent some of the very, very negative things that happen from, when mental health is really not managed correctly.
And if I can jump in as well, one of the other issues you mentioned, Talib, with regard to the lack of violence occurring because the kids were not in school, as possibly being a good thing. But as Dr. Bay can attest, one of the issues that raised its ugly head with the kids being at home is the increase in domestic violence, in intimate partner violence, and the amount of child abuse that was occurring because of the stress levels that were raised with parents or parent trying to deal with children who were home 24/7. And so there needs to be a concerted effort to address the mental health issues, as Dr. Corley mentioned, with regard to our approach to families and children as a whole. Additionally, we unfortunately recognize that there has been a subset of our population that has been, for lack of a better term, radicalized. And this is occurring not only in young children, but in adults. And this total disregard of the truth, disregard of disrespecting people, the increase in violence has created a unfortunate society, sub-society that will possibly outlive this pandemic. And so we're going to be leaning on our mental health specialists like Dr. Bay and others to kind of try to right the ship with regard to the impact of this social injustice and combined racism on particularly populations and people of color. The last thing with regard to, you asked whether this is a United States problem. It's partly because of our dependence on the digital platform for communications. And so people have become vulnerable to the interaction in the digital mainstream. There are evil people out there who are subjecting all sorts of harm to people by enticing them through the internet interactions. And so this is
I think that there's a problem with Dr. Price's internet. He was talking about some of the issues, and I think this might it's interesting and striking, and perhaps Attorney Fraser can mention or bring in here. He talked about the issue of I think to some extent extreme perspectives, and I think this kind of brings into play the issue of the mandates. There is a stream of thought that the mandates themselves, by the pressures, and perhaps Dr. Bay can jump on this as well, that the stressors of having mandates, particularly the COVID mandate itself, where there are valid concerns that people have, especially in the African American community that has had a long experience with vaccines having the opposite effect of what they're supposed to have on our community. And so these mandates have, both because they've been mandated, in some cases, people are losing their jobs as a result. And I know that just recently, one district court, a couple of district courts struck down the federal mandate. It just the Court of Appeals has reinstated it, and I'm sure it's going to go to the Supreme Court. And given the tenor of the court, they're likely to go with the district court. But what are your thoughts about that? And from a legal standpoint, and from a mental health standpoint, Dr. Bay, what are your thoughts about these possible stressors contributing to the violence that we see taking place around our country?
Yeah, so definitely, COVID and the mandates have presented a lot of divisiveness, right? And the part about that is so unfortunate is that vaccines are not new to us. You know, in healthcare, the flu vaccine has been mandated for healthcare providers for years now, and we never saw this type of response to it. And so the fact that individuals have politicized kind of, the wearing of the mask, the taking of the vaccine, that we have made it a legal issue when it really has always been a public health issue that we need to be addressing, is have put us in a state where, yes, we are in a state where there's a lot of divisiveness because of it, and because people feel so strongly on both sides of it. It is absolutely leading to violence in many different respects. You see healthcare workers being attacked because of their role in trying to manage the COVID-19 pandemic, and their role in trying to make sure that when others are there from the public, and even some of their coworkers, that they are enforcing the rules that we put in place to try to keep everyone safe. That because there are strong beliefs on both sides of the fence that this is definitely leading to more violence than we've seen before. And again, I say the unfortunate part is that I've been working in healthcare for quite some time, and I represent hospitals and nursing homes and physician groups all over the country. And I did not expect to see what we are seeing right now, even when we reach pandemic status, because early 90s, well, 2009 or so, like that, when we hit the pandemic status with H1N1, we didn't see any of this, right? And so I was completely not anticipating when we hit that global pandemic status that we were going to go to the point where the taking of a vaccine or the wearing of a mask or putting public health mitigation strategies in place to try to keep people healthy and safe was going to turn into such a political and such a violent issue among all of our communities. And I think what you're right with the courts, you see organizations trying to push forward because they're trying to get back to some type of norm. And so they want to be able to not have a situation where every week half of their workforce is out because of the vaccine or because they have to quarantine. And so many of them want to put these mandates in place so that they can start moving towards some type of norm. But there's resistance from the courts, there's resistance from individuals. And we live in such a litigious world right now that the first thing that people do is say, hey, let's go to court. And so right now, where we're trying to move in a direction that would help us get back to a safer environment, we're really kind of stalled right now as this play out in the courts, right? And the likelihood that some of the mandates that have been put out there are going to be able to be successful, remain in place is unlikely, right? And that's very unfortunate as well. Because what we will see is that we're going to stay in this perpetual state of not moving forward, right? The virus is what it is. We've seen it, mutate in various different ways. We've also seen that when we take those mitigation strategies, as Dr. Corley was able to say, the success they had at their university is because of the precautions and the steps that they took, and their incidence rates was down low. We know that those things work, right? However, it's just trying to convince everyone else that those things work, and at the same time, change the attitudes of people about what this is really about. And this really is about healthcare. It's really about saving lives. It's about not only physical healthcare, but mental healthcare. And the hope is that we can change this focus from being so like I said, political and divisive, because where it's at right now, to something that is more focused on caring about that whole person and making sure that our communities can thrive.
Yeah, and if I may, I'd like to piggyback off of what Ms. Frazier was saying. Okay, all right. So just a couple things, and I wanted to write it down because you said a lot. It was great. Some of the information about the healthcare workers is a fact and is true. I am a frontline worker. I have been there in hospitals, in the clinics, in the healthcare industry, making sure that the healthcare, the mental healthcare, because a lot of times the physical and the mental healthcare are one and the same or very similar. Been there, and it's very difficult to try and treat the clients and treat the patients when you're constantly worried about your own health and well-being. And if we have laws in place that will be able to make sure that there is no question on that, you don't have to question whether or not there's an option of wearing the mask or an option of taking the precautions you need to. If it takes that away, then it makes it a bit easier for the healthcare workers to be able to do the job they need to do and to be present and accounted for their clients. And really, as a person who's, again, a frontline worker who's in that system, in that situation, it really will make a difference for us. And I've seen this and heard this with my fellow colleagues, the same sentiment when it comes to being able to have those laws in place. So yes, if Ms. Frazier can, or people like her can certainly make those laws come into fruition, make that something that is going to be a certainty for us as workers, that will be make a great deal of difference for us. And just to go back to what Dr. Price was saying about this kind of separate topic, about the data for the schools. Now, so the data for the schools are skewed, right? Because clearly if you're not in schools, then the violence in schools will be down because you're not in schools. But to Talib's point, the violence in domestic situations has definitely arisen as well, not just with the children, but adults too. But there has actually been statistically shown that there are some issues when it comes to violence with children against their parents or against their caregivers. And that's oftentimes, it's historically high. And it's oftentimes overlooked when it comes to just the general domestic violence. But that's a concern. That is definitely a concern. And also when it comes to the school district, if you put the kids, you take the kids out of the schools. And for one, I know my kids actually are in a Title I school. A Title I school means it's a school where you are like some of the things that they provide, some of the community members that are in the school, the students that are in the school, and the families that attend the school are below the poverty line. If that's the case, then they need to put in separate, different programs in place and things like that for the schools to thrive, for the students to thrive. And when it comes to being able to have those resources, they're there for the students and the parents to be able to take advantage of. But if they're not in schools, they're not really being able to take advantage of a lot of those. And so they've been, and it's not the school system's fault necessarily. It's just they're scrambling to come up with the resources to be able to get those things completed for them. And so that they're able to get that, for example, if you're not able to concentrate on your school because your work because you're not eating, then you can't do the work, and so they're trying to find ways that they can still get those free lunches to these kids and free breakfast to the kids. And sometimes if they don't go to school, they don't eat.
I know that in the state of Maryland, they were giving the parents the cards that the students were using for their free lunch. They were able to take those cards and actually use those to buy food. Almost.
They were, but what happened before that? What happened before that? They had nothing. So
right.
They were scrambling to try and find something for them. Yeah, and it was a mess.
It was.
But they were able to clean up that mess eventually.
And I think that those you raise a couple of points. It seems to me that if there are some things in place to provide parents with more stability in their homes, more food for example, right? Basics. The ability to be able to not worry about, whether or not they're going to get evicted. I know the eviction moratorium. I mean, and we, and I think that we need to take a quick intermission, but there's some couple issues I want to just kind of put on the table, and then let's bring them off the table after the intermission. So one thing that I want to bring on the table is, Attorney Fraser mentioned that if we get, people vaccinated, then, we won't have to worry about them going out of work because of. We can see every single day, especially right now in the National Football Association. The Washington team and the Philadelphia team were supposed to be meeting on Sunday, but that game is being canceled because of the name, or at least being postponed because of the number of players who are COVID positive, even those players who have gotten the vaccine. Same way in the National Basketball Association and in college sports. So it's clear that those people who say that the vaccines are the pathway to normality, that's not true. And so there that comes up to something else that we haven't yet talked about, and that is the comorbidities, the things that are actually causing people apparently to get COVID more likely. Again, obesity, hypertension, high blood pressure, things that actually were being discussed before the vaccines became, the kind of conversation of note, but apparently have not been even brought up again. So
well, we're assuming the vaccine oversight by those leagues is stringent, because I'm sure.
Hold on, Dr. Price.
That
I want to bring that up on the other side of the break. We're going to take a quick. It's
Sure.
4:00. We have a break in place, but that's exactly why I pose that, because I want people to be biting at the chomps, so they will stay. And when we have this quick break, and after the videos, come right back in. So stand by for again a continued conversation after we hear from a word from our sponsors.
Hello, I'm Dave Velasquez, President and CEO of Pepco Holdings, which includes Atlantic City Electric, Delmarva Power, and Pepco. The work we do touches millions of people every day, and we recognize the responsibility we have to reach them in a meaningful way that actually makes their lives better. From tackling climate change, to pushing for social equity and an end to systemic racism, to supporting economic recovery, growth, sustainability. This is how we think about what we do at PHI. This is what drives us.
We talk about values, we talk about diversity, but to see that we put that in motion, having PHI highlight these topics and have discussions around these topics, and then going out in the community to serve these same groups, it's
Virginia State University is located on 235 acres in Chesterfield County, Virginia. It overlooks the beautiful Appomattox River, just outside the city of Petersburg, Virginia. Virginia State University was founded in 1882 by Delegate Alfred W. Harris, who dreamed of one day creating a place where all may go and drink from the fountain of knowledge until their ambition is satiated. In 2016, Dr. Makola M. Abdullah became the 14th president of Virginia State University.
Invest in the right programs to provide a quality return on investment for the nation.
A native of Chicago, he is considered the youngest African American to graduate with a PhD in engineering.
Thank you. Let's continue to move forward.
President Abdullah emphasizes several areas to sustain VSU as an 1890 land-grant university.
I'm here to become a computer systems analyst.
The areas of focus include providing a transformative experience for students,
I'm here to become a manufacturing engineer.
strategically investing in academic programs,
help me achieve my goal.
partnering with others as a university to tell the VSU story,
We transform lives.
embracing the university's land-grant mission
Since 1882,
and embracing Virginia State University's role as Virginia's Opportunity University.
I'm Malcolm Jamal Warner, asking you to secure your future at Virginia State University.
We have to learn the secret to our success. How are we able to outperform others?
If we contemplate our past to understand ourselves, there we will find how far we have come. How far we need to go. In what we have become. In what we will eventually be. If we search even deeper, consider all the elements that make up our human potential, there we will find an awe-inspiring discovery. Knowledge is to be sought, gained, embraced through education, and this education transforms everything. Ignorance becomes awareness. Awareness awakens possibilities. Through education, life unfolds, expands, takes shape. And through this self-revelation, we gradually appreciate a saying passed down from generation to generation, an adage whose meaning becomes apparent. And the saying is this, that when we combine a willingness to learn with the pursuit of knowledge, magic happens. I'm Angela Bassett, here to ask you to support Virginia State University, building a better world since 1882.
I think that was an amazing array of programs. I'm quite impressed by those great visuals that you guys have there at Virginia State University. I was quite impressed, especially about the Angela Bassett win, to have her. Is she an alum, by the way, Dr. Corley?
No, she's not.
But
She's
definitely a great supporter, obviously.
Yes.
Well, congratulations. You guys are doing some amazing work there at Virginia State University. And we're very, very happy that you had such a celebrity as Angela Bassett, as well as, the entire leadership team with Dr. Makola Abdullah there. Quite impressive. So let's get back to this conversation. On the other end of the break, we talked about, again, whether or not vaccines are actually able to keep us safe. And almost every week, in some cases, there's a new, booster that is being required in some cases. And again, parents are concerned. They're concerned about whether or not, again, all this medication being pumped in the arms of their children is safe. They're concerned about having to take them themselves. Those of them who are actually educators, who have to go into the schools, and then you have again parents who are feeling that their children are being victimized, especially children from communities who are, for example, Muslim children who are going to public schools as opposed to going to Muslim schools. They're concerned. Are their children going, especially as and I can speak myself as a child who went to public school, who was Muslim and am Muslim, going to the public schools in my community, even in Michigan, where there was a high concentration of other Muslims, it was every day was a battleground for me growing up in school. I know that firsthand. I mean, and it created some character, that helped me to become the man that I am today. But do I want to send my children there? Absolutely not. You know what I mean? I am. So the question is what do we say to these parents who are concerned about their children being attacked, possibly even being shot, in some cases killed while they're going to school, versus keeping them at home and at least being able to protect them in their home, and hopefully make sure that they have a safe environment to learn. What do you say to those people? Let's start with you, Dr. Corley, and bring it back down to Dr. Price.
So thank you for that question again. First, let me say to the vaccine piece. I'm a product of Tuskegee University. I used to work at Tuskegee University, and I was a consultant to the National Center for Bioethics in Healthcare and Research. So that means I value autonomy, I value beneficence and maleficence. Do no harm, to do good. But I tell you this from a practitioner standpoint. One, COVID is not a stagnant process. It has not been. It's dynamic. So I think we have to keep in context when we even talk about the vaccines and how they've been able to protect or not protect. When we first started this process, we had parents that actually were concerned that we had not mandated the vaccine. They said, how can you bring our son or daughter back to your institution and put them in a room with somebody who was unvaccinated? And so I'm really speaking to the component in which you earlier talked about, that the emphasis and pressure that came out of mandating vaccines. One of the reasons, and it was a very difficult decision for us, was one, we didn't want to create an additional way to segregate out a population that's been segregated out historically. So that's what made the decision so difficult for us. What made the decision easy was that we had just experienced a semester in which over a 40-day period, we had more COVID cases than what we had in this previous semester. And so we knew that just like other universities, it was very difficult, not just to detect, but when it came now to detection and it came down to isolation and quarantining and contact tracing, it was a task that most institutions, health departments, they really weren't ready for that. And so we managed that process through the spring semester. And we realized that a lot of universities across our Commonwealth and across the nation, they actually were running out of quarantine and isolation space. They had to get rid of dorms and make those basically mock hospitals or containment areas. And so that really challenged the whole framework of how we worked. Vaccines brought a solution to that, in addition to additional mitigation strategies. And so I think a lot of the great data that we had from this previous semester, again, came from the layers that we had from education and all of the other mitigation strategies. But I can guarantee you for that semester, the one we just finished, vaccines play a major role in it. And we understood why we did that. Now, to your point, we all are familiar with what just happened in the past week in Cornell. Cornell had over basically 904 cases almost within a week's time. And what's amazing about that is that those cases occurred as students were preparing to leave. So that meant you already had whatever homecoming events they had, You already had, now you're getting a bump from Thanksgiving, and now they're on their way out. And so as you think about that, from what they say, there's most of that was Omicron, right? That doesn't mean that we shouldn't get vaccinated. What it means is, though, now we need to have different and additional strategies in place to combat something that is ever changing. And so I just wanted to kind of keep in context that just because you're seeing cases now, and if you look at the level of disease in individuals that have been vaccinated, it's lower. What my concern right now is that since Omicron, in these cases where they've had 96 and 97% folks vaccinated, that now we have become basically the vehicles to actually spread COVID to the unvaccinated population. So I don't see any of this as saying we shouldn't get vaccinated. I actually see it as being able to understand the enemy that we're up against, and now that we have to be very proactive to make sure we have our boosters, but also to put in place the mitigation strategies that will help keep us safe as the virus continues to evolve.
I think that that's a very interesting perspective that you have, and I'm sure that it's shared by perhaps most of the people on this panel. I don't know if the Lieutenant Governor would share that perspective, and we're looking forward to perhaps her coming back. We're grateful that she was able to join us. From going to the standpoint of the social pressures, Dr. Bay, again, by the impositions of the mandate, and how that might be contributing to the violence that we see in our schools and out of our schools. Can you speak to that, please? And I want to definitely bring Dr. Price, because he was chomping at the bit to talk right before the break.
Well, I'm sorry, Dr. Price, for taking up your spot. But
No problem.
we gotta be brief. But yeah, so when it comes to dealing with the issue of pandemic in the schools, and how the school system is feeling about that, or how's it, well, I should say how they're addressing it. I can just give an example. This week, Prince George's County is now going back to all I think at-home school in order to safeguard the kids from the recent variant, which is the Omicron variant that's cropping up, and that's something that was certainly not actually endorsed by our governor Hogan, but it was something that was necessary based on the data and based on the information that was there. And so, but what that does is it also, as you know, it's like groupthink. It has that effect of, well, if this county is doing that and there's numbers that are looking like that, our county needs to look at our numbers and see if this is something that we also need to do. So we can also have that opposite effect. If their counties were starting to look good, and they start to open up, then as you saw, there was a opposite effect where the other counties were doing the same. I'm in Howard County, and that is in a county that is next to Prince George's County, and is also having numbers that are cropping up as well. And that creates a dilemma for the parents as well as the students. The students, they need to have that social emotional learning that I believe Fraser was mentioning earlier. And that social emotional learning is something that you can't necessarily get from parents or get from the academics of school. It's the being connected socially with other peers. And if they're not able to have that, it does have an impact on them. And there's actually a study done by the Harvard Business School, that's Harvard Business Review, that actually was talking about the impact that that COVID has had so far in 2020 on the social emotional learning of students. It's an ongoing study, so it should be a longitudinal study, but what they found so far has been concerning. There has been a lack of connection to being able to connect with peers, but not only that, but the motivation to connect with peers has already started to wane. And that's very concerning, because what does that look like then for us as a nation and us as a community if the people that are coming up that are supposed to be taking care of us later on in life aren't able to connect with each other and each other in a way that's both helpful and healthy for them. And then there is, of course, like we're talking about today, the violent situation and how that has an impact on how they're going to, deal with the different emotional states of themselves in a social environment.
So, Dr. Price, again, you were chomping at the bite to chime in on this conversation about the mandates of COVID, and particularly, I was talking about the fact that people are getting COVID while playing for some of our professional teams, and you had a perspective to share on that. Please go forward.
Right. Well, there are a number of things to unpack with regard to the conversation, and it's very robust dissertation amongst the panelists. That said, we want individuals to go to college to learn and then to spread knowledge. We don't want them to spread a virus. And the vaccine does not make individuals more susceptible to spreading the virus. I want to make sure we're clear on that. Number two, I want to make sure that we understand the science has shown clearly since the vaccine was available that overwhelmingly individuals who are vaccinated and now with the variant who have received their boosted dose do not end up in ICUs on respirators and dying. So the importance with respect to this particular pandemic, the COVID-19 pandemic, vaccinations is our way forward back to normalcy. Now, we know that vaccines are safe. We know that vaccines are effective. We have a whole host of nearly 15 diseases that our children are mandated to get as part of their protection to be in a school environment, and they work. We've avoided millions of deaths over the years. We've avoided millions of children suffering the long-term effects of some of the worst ills of our society, and polio and meningitis and hepatitis. And so it's important that we not turn our back on a mandate, because a mandate works. In particular, what we want to do is to get to a level of herd immunity by getting a certain segment of the population to get vaccinated to avoid the virus from being able to have its transformation to different variants. And we can do that if we didn't have as much negativity. The point with regard to the Football and Basketball Association, we know, unfortunately, that there have been individuals who have feigned the fact that they're vaccinated or immunized. And I think one of the sad parts that will come out as we look at this outbreak among those teams and the other gatherings of people in large groups is people are using falsified documents to indicate that they're vaccinated when they are indeed not vaccinated fully. And so this allows the virus to raise its ugly head and spread out of control. But this particular vaccine is probably safer, given all of the scrutiny that it's been under in its development. The technique of the vaccine is not new. It's been around for 10 years. And the science that we have today has allowed the development of the vaccine with adequate funding in a shorter period of time than the normal process. But this vaccine is safe, and it's the only thing that we've shown based on the import of disease that's been caused by individuals who are unvaccinated and ending up in the ICUs and dying. And we cannot afford, particularly for communities of color, we cannot afford to have our healthcare system strangled by individuals who are resistant to getting vaccinated and allowing people who have cancer, who have diabetes, who have motor vehicle accidents, who suffer from the unfortunate violence related to this society that we live in America. We can't afford to have them turned away in emergency rooms and hospitals because we're struggling to deal with this pandemic. And so I'm hoping that in all that you do, that you can stress the importance of vaccinations to your family, your friends, and be able to change the mindset of the resistant individuals. You know, Talib, no one hesitates when we have a storm or even this most recent tornado of going into the face of danger for your neighbor to help them. You don't ask, what would happen if I go into this unstable building? You know that it's the right thing to do to help your fellow citizen. And the vaccine is that stance that you need to take to help your fellow neighbor, your family, and America. And we can do this, but if we don't, we're going to struggle for many more years with respect to this pandemic alone.
Well, I think that that's a really interesting perspective. And again, if any of our guests would have any questions, they're welcome to share them. But you know, there are people who, and I was watching, is interesting that you mentioned this, is that I was watching a feed from the school board at Oxford, Michigan, their Board of Education, after the shooting of the 11 students and one educator there, and the killing of 4. And, you know, they were not only talking about against vaccinations, but they were talking about the mandate of the mask.
Mm-hmm.
And, you know, as somebody who, and I'm myself personally, I'm skeptical about the vaccination, as there are a lot of people in our community who are. Of course, as a former chief health counsel, for a member of Congress, former chief of staff for our Department of Healthcare Finance, which manages the Medicaid program here in the District of Columbia, I'm well aware. I'm an engineer, so naturally I'm a scientist as well. I'm very not against science at all. I'm very pro science, in fact, but definitely concerned about over medication and over reliance upon again a perspective, a unilateral perspective on health coming from certain segments of our community. And this is my own perspective. I know this perspective is shared by other people, both who are in the Black community and people who are not in the Black community, as we saw there in, again, Oxford County, which is not a predominantly Black community. And so, I want to ask, I want to ask the panel, for those people who actually genuinely have doubts and, whose doubts, are valid, what do you think needs to be done to improve the messaging? Because from a lot of our community, the message is, well, if you're not vaccinated, then you are crazy. And I don't even credit your perspective. And it seems as though that is also contributing to this tension that perhaps might be expressing itself violently. Perhaps Dr. Corley and Dr. Urbay, and even Attorney Fraser, you want to take a crack at that?
Yeah, I want so I do want to jump in and say, the concern for hesitancy should not be taken lightly. Like certainly individuals have hesitancy, and for a number of different reasons. One is because, especially when you start to think about our community, the African American community, people of color, there's not been a lot of trust even within the healthcare system, and not those Tuskegee experiments and things like that that we know about, just your everyday experiences, right, have proven to be something that have caused people to have a lack of trust in the healthcare system. So by all means, I think that the hesitancy should be recognized, but as we're thinking about that, and for me, I've done vaccine hesitancy webinars. I've spent time with the Pfizer scientists and others as we have talked about the importance of the vaccine and things of that nature, but don't want to downplay in any way the fact that people are hesitant. But I think we have to make sure that we're not putting out there a lot of misinformation. What I have seen is that there's just a lot of misinformation. For one, I continue to hear comments as if the vaccine is preventative. This vaccine is no different from any other vaccine that's out there. And none of the vaccines are preventative. So the fact that someone would be vaccinated, but also may contract COVID, that's true of every vaccine that's out there. None of our vaccines are, and this one is no different. Somehow, I think people are viewing this as different from the vaccines that many of us received as children, right? Whether it's chickenpox or measles or mumps, whatever that might be. This vaccine is no different from that. And I think people have to see it from that perspective, right? It's not intended to be preventative in any way, shape, or form. I echo many of the comments from Dr. Cobb in terms of, Price, I'm sorry, in terms of, the effectiveness of it and the importance of it. But I also think that it is very important that we have those conversations about why are you hesitant? So as I talk to folks in my community, I also serve on the board of a charter school here in Indianapolis. So I spent the last 18 months, frankly, making decisions for our school in terms of whether we were going to come back, how we were going to come back, and what protocols we were going to be in place, listening to parents, listening to the educators, and tell you, parents want their children to be safe. And not only from school violence, parents want their children to be safe from a health perspective too. So we had many parents wanting to know specifically, tell me, what kind of mask policy are you going to have before I decide if I'm going to put my child back in school? Tell me what kind of other mitigation strategies are you going to have in place? Tell me, are you going to require the vaccine? And if not, then those who don't get the vaccine, how is that going to be handled? So what I saw from my parents at the school that I serve on the board is that there were a lot of concerns about their children's safety from a health standpoint as we talked about what were the best practices to put in place in terms of trying to bring our kids back into the building. And again, lots of hesitancy because the charter school that I work with, it is predominantly African American and Hispanic, right? And so lots of hesitancy when it came to the vaccine. But what I saw that could help with that hesitancy was, again, providing that education about what does getting vaccinated really mean. Again, it doesn't mean that it's a prevention, right? But it does mean that it's going to help slow down the spread of this thing. It's going to help not continue to allow it to mutate into all of these various different variants. And it is going to reduce the severity of symptoms. So we're keeping people out of the hospital or at that very severe level at the hospital. So to your point, Talib, hesitancy is there. I think it's valid for a number of different reasons, both historically and what I continue to see happen in the healthcare system right now. However, I think the way that we as thought leaders in this area help with that is that we educate folks on what it really means to be vaccinated and why it is something that, it is something that you not only do for yourself, but you do for others. Because when we do that, then as a community, we will start to be able to move forward. So I'll let others jump in, but as you can tell, I'm very passionate.
I just want to clarify one point in terms of the vaccine and the term preventative. The vaccine produces a immune response at varying levels in different individuals because everybody is different. But that said, for the majority of the population, the vaccine will produce enough antibody response that it will prevent them from contracting the disease. Now, some of these breakthroughs that you're seeing are individuals who are only a few weeks or months out of having gotten their vaccine. Some of them are in individuals who have immune systems that don't respond as fully to the vaccine as we would like. But it's the same thing with the flu vaccine. If you get the flu vaccine, you get protection, but it's not 100%. But if you get the flu, it's going to be a milder case. Now, you look at the numbers of individuals who have gotten the vaccine, and we're talking about some 267 million doses of the vaccine. The majority of the individuals who are fully vaccinated do not have a breakthrough. They've been prevented from getting the disease. And that said, individuals who ending up in the hospital on ICU beds and dying are not vaccinated. They have no protection whatsoever. And so the vaccine push is for that. With regard to hesitancy, we never present to an individual who is hesitant to kind of castigate them to say, you're stupid, you're idiotic. How can you say that? What we do is we engage them in conversation, and we just want to give them the facts and the evidence and have the conversation with them. Because you can't do the misinformation. You're not going to become magnetic. You're not going to lose your fertility. You're not going to have issues with respect to people monitoring wherever you are in the United States because there are bots in the vaccine. We just need to help them dissuade those misinformation. And I can tell you, a good segment of individuals who are hesitant when we talk to them in the practice and in the community believe those pieces of misinformation they're getting on social media. So that's what we need to address as a community and people's of color.
And I know that some other people want to chime in, and I want to ask people to maybe speak on this because I'm also a former chief counsel to a member of the House Judiciary Committee. And it was revealed in the House Judiciary Committee what type of government surveillance was taking place by this United States, unbeknownst to the public. Of course, we know the Snowden files that were revealed, and even the files in WikiLeaks, which is the reason why the founder of WikiLeaks is currently in jail right now. And so when you have these types of things happening, these are not, rumors. These are, historical documented cases of misdeeds by these United States. Just recently, I think you might have known, on December the 4th, there was a celebration of the 52nd anniversary of the assassination of Fred Hampton, who was assassinated by the United States government. All right. And so this, and one of our members of Congress, Congressman Bobby Rush, actually reminded us of this. He's a member of the House House Energy and Commerce Committee, which has oversight over some of the things that are taking place in terms of the vaccination protocol. But the realities of these things that are happening even today, right, are part of, maybe not even hesitancy, but maybe even straight up fear. And there's a growing body of people who believe that, the conscious people, who are conscious of these things, are the people who are not going to get the vaccination. And, our brothers and sisters who do get the vaccination, have a limited, time, left because there's going to be some shelf life. This is the reality. This is a very strong fear. And I think that, so on the one hand, there is a conversation about, well, we just have to convince the people that what they think is, not the truth, or what they think makes no sense. But the question that I have is where do you think is the medium? Because with 40%, I think, and in some cases greater than that, of the population of the country who are not vaccinated, I'm not convinced that you're going to move that needle by just having conversations. What do you think is a medium, a middle ground that we might be able to reach, with the same idea of also keeping people safe? Dr. Corley?
Yeah, so I would say that we probably missed the first great opportunity. When this first began, we all knew it was both a physical but also a psychological battle that we were up against. And so the original messengers that went out, I'm not going to say it was intentional, but you could say that it was intentional, that they created chaos, havoc. There's an old saying, and this really speaks to our community, is that at a certain point, nobody cares how much you know until they can believe and understand how much you care. And so we lost that opportunity to do that. And so in the process, what it created was not only in mainstream media, it also created in the individuals this idea that just what's up on the screen, that if you don't get the shot, then you're crazy, or you're stupid, or you're going to die. And basically what happened was, at that point, people had already reached that reserve level where they needed something more than that. And so now they were going to be resistant. One of the things that we did that we found to be very helpful was we used cultural responsiveness actually to communicate to our students. So I could stand up and say, this is what the data says. But at this point, these are young adults who are living through a pandemic. They've heard how this was rolled out through the previous, federal government and the administration. They saw what was going on at some of the state levels. And so they quickly lost trust. One of the things that we did, we brought in comedians who not put pressure, but who could just really talk about COVID in a way that made people feel relaxed. It took them out of that stance that I'm being resisted, and it put them in at least a venue where they could hear, so that they can now make an informed decision. The psychological battle was something that I say intentional, because truly when you're trying to move a population forward, you don't do it the way we started this. We're talking about as a nation. You don't do it that way. And so I think we missed, I guess, like I said in the beginning, we missed a great opportunity to really be a whole lot further than we are. So now that means in our conversations, we have to go back and use culture and use relationships, right, that are established in order to get people not to say yes, but to get them to be in a position where they can make an informed decision, because now we created a conducive environment. Give you another example. When people first start wearing masks, in some places, everybody who wore a mask, people thought they had COVID. You go up to some of the Midwestern states, you put a mask on, they think you're unvaccinated. And so even the perceptions of the folks, not just the mainstream media, us as individuals, how we responded now to what we were fed. And then now we absorb that, and now we put that right back out there. And so the resistance is high until we're able to break down those barriers that kind of continue to create that divide. Last thing on young adults, one of the things they've told me is that, don't tell me that I'm going to die. They said that just doesn't work for me. That's not enough for me based on the life experiences that I have. And so us being able to, again, when I say culturally responsive, also to be able to reach them where they are, is going to be critical for that. Sometimes we're the best person, sometimes somebody else is.
Yeah, that's a very good point. I mean, and I think that the one commenter here is saying that conversation is only one part of the ingredient. There has to be a more holistic, offering. And again, one of the things I haven't heard is the emphasis on health and fitness in addressing these underlying issues that appear to be, again, one of the main things that are causing it. We seem to have gotten so focused on the conversation about the vaccinations that we're not talking about obesity. We're not talking about hypertension. We're not talking about high blood pressure. We're not even talking about fitness. We're not even talking about, again, people keeping themselves healthy, their diets, at all. And so the question is what do we need to do to bring those pieces back into the equation? Because again, even I think it ties into also the violence issue. There appears to be the people are sick. They're walking around with sickness, both physical and mental sickness. And there have been studies to show that fitness, particularly, exercises such as yoga, Pilates, and other forms of exercise, helps to mitigate some of these, comorbidities, and definitely helps to address issues of mental health. In fact, there was one study that showed how students doing yoga before going to class helped to, drastically reduce the amount of, misconduct, if you will, in the classrooms. Perhaps Dr. Bay and either panelists can speak to that as we think about closing.
So yes, let's be real here. So when we're talking about looking at the impact that this has on the children, or impact it has on the society as a whole, they are one and the same. So we need to be honest about that. And also another thing is, we are now just giving flashlights. The information, or the issues that were there were already there. They were just now exacerbated by the pandemic, and now they're made clear. Just like with Black Lives Matter, the issues like that Black Lives Matter were mentioning, they were already there. We just now have flashlights, and now they're brought to the forefront. Now we're not talking just about things that are interesting to talk about. We're talking about things that matter, things that are important for us to know and to understand and to do something about. And Dr. Corey has some great points. There's so many I want to touch on, but I don't have that much time. But really, so when it comes to the mental health part, when it comes to being able to focus on the healthcare of the people who are, handling our kids and handling important decisions for our society, we need to make sure that they understand that this is something that's important to us. And I think that because of COVID, because of the pandemic, there's been a lot more of that happening, which is a good thing. A lot more of that happening where you're able to get your voices heard about mental health and about bullying in the schools, about violence, about the lack of healthcare, and about fitness and yoga and things like that. Very, very important parts. But they unfortunately had to happen because of a tragedy, because of something that occurred. Just like when there was a tragedy recently with the tornado, and we realized there's some infrastructure issues that were there that need to be addressed a long time ago, that now are clearly need to be, they're now in the forefront. They need to be addressed. Things like that need to not just be something that we just talk about as talking points, but things that are important for us to do something about. Some services in place, some activities that we're doing. And we need to do them because it always starts with the individual, with us, and then it goes out to the greater community. So there's always us, and then there's our families, then there's the community, then the society as a whole. So it starts with us, and then it emanates outward. And that's how we can do our part to deal with the pandemic, as well as deal with the people's issues with their mental health and mental illness. And also, we just had a month-long suicide awareness within the clinics I work with, but just overall the month of November. And they were talking about some of the things that we can do as not only as clinicians, but just as people in our communities, to just be more mindful of the people around us. If we see someone who hasn't, maybe they haven't left their home in several days, maybe just give them a visit and see how they're doing. Just check on them, or a family member you haven't checked on in a while, or a friend that you only see on Facebook, but you see like they always are posting things that just seem to be a bit off or not unlike themselves. Things like that. It's important for us to see how we can do and make a difference in our own communities, in our own smaller communities of people that we know, to be able to have an impact.
And that's important because we certainly, in our approach to give free vaccines, we didn't approach all of the social determinants of poor health outcomes by saying we're giving free health care and free preventive screening and free medications to build back your health on the global scale. And certainly some of these rescue funding and certainly the infrastructure and hopefully the Build Back Better will provide all of those other incentives for people to feel that what we're doing is in the best interest of them as a person and as a community. And I think we'll get there.
Well, I definitely would like to say that this has been an amazing conversation, and I see that Carmen is saying that this war on unvaccinated doesn't work, and that we got to change this conversation. And again, I in seeing what you just said is, I think, also a really good point, Doctor. And that is, you seem to be kind of two realities. On the one hand, you have certain people who seem to be making good money. They say there's a 4% unemployment rate, but there's a lot of people who are not being counted in that unemployment rate, at all. And so there are a lot of people in our communities who are struggling big time, right? And they don't see any, Build Back Better connectivity, right? There's nothing in this Build Back Better legislation that means anything to them. And again, this is somebody who is from Washington, who spent my time working in Capitol Hill, and I can tell you that this is a sentiment that I'm seeing out there. And so they have their reality, and at the same time they have this reality of people trying to incentivize or encourage them or demand that they get vaccinated. And they believe, and some of them have said, well, the spread of the virus isn't being caused by people who are unvaccinated. They say that it is being spread by people who are vaccinated, giving their variants to those people who are not vaccinated. This is the statement. Again, I'm not an expert in terms of that particular issue, but I can say that the comment here that is on display is very potent, and that is that we have to do something different. And I believe that perhaps maybe a middle ground might be to really start focusing on fitness, both mental and physical well-being, and really concentrate. And I only would point to Dr. Corley's, firsthand account of what they did at Virginia State University, which seemed to me to be what has caused there to be such low rates of, problems there as opposed to some of the other institutions. We're heading out of time here, but I'd like to have everybody kind of give any points that they might have as a kind of closing, let's create a toolkit, right? So in our last minutes, what would you say if you were going to put in this, toolkit for keeping our children and our students, our children, our students and our educators safe in schools? What would be your toolkit? And let's just kind of go around and close it. Start with Dr. Corley. What would you put in the toolkit?
Hope. I would say in the midst of the pandemic, the mental and physical aspects of it are challenging. But what we really are afraid of is when those two get to a point where they damage the spirit. And so that spirit is not only of the students, it's of the parents, it's of the teachers, it's of the administrators, it's of us as a country. Because in essence, that's what comes next. And so I'm very hopeful now because I know that humanity is at stake. I know that there's a population of individuals that understand the true challenge that we have. And that out of this, we will be able to actually be innovative, be renewed, and be in a better position to really thrive as a people. But it's going to require us to really focus on awareness. There are people who are hurting. COVID has impacted more than just what we see. It's going to be generations without parents. The comorbidities that we talked about, we haven't even seen those yet. The impact of students not being vaccinated in school when they were out, parents not going to the doctor, and other mental health needs not being met. So a wake-up call, awareness, but I'm still hopeful because I believe in people. I believe in community, and because I believe in God. And I believe that together we will be able to find a place to move us forward.
Amen.
Outstanding. All right, Dr. Bay, what would you put in your toolkit?
Well, so many things, but I would have to say that really building on our resilience as individuals as well as society is really important, and being able to put those tools in place to be able to have success in those areas. That means not only from our political standpoint, but from our health care industry, from education systems. Everyone needs to play their part to be able to make sure that we are able to build up stronger and smarter and healthier kids than what we're seeing today. And it's important for us to also see each other as we are. There's I wanted to kind of, I see some here's some noise. I want to kind of end with a surah from the Quran from Al-Anfal 46. It says, "Do not dispute with one another, otherwise you will fail and lose your strength. Have patience." And we need to have patience with all these things we're trying to do, all these things we're trying to put together. It's important that we maintain the course of action that we're going in. Make sure that the course of action is helpful and healthy for us, but make sure we maintain it, because we get discouraged. No one knew that we were going to get into a pandemic right now. No one knew that it would be so disruptive to this point where our kids couldn't even go to schools for over a year. But here's where we are. This is what we need to do, and now we need to adjust. And part of that adjustment is being able to see each other for who we are and what we are, and be able to motivate those who are able to be in a position to make those service decisions for us to be able to make better decisions for our community and to build us up to be stronger.
Outstanding. Attorney Frazier, what would you add to the toolkit?
You know what? I'm going to add positivity and encouragement. And the reason I say that is one of the things is so Dr. Bay said something earlier in our conversation about it starts at home. And I absolutely think that that is the case. And so one of the things that I've started doing with my daughter since she's been back at school is every morning before she leaves, we do a positive affirmation. And I have her say something positive that she is looking forward to within herself and for her day and for her classmates and others, so that she leave the house every day on a positive moment with the right mindset and knowing the importance of right from wrong and not being one of those aggressors. And also doing that with the teachers and the staff. So I've been very intentional about reaching out to the school and letting them know, that, I'm available if they need help, but that we appreciate all the hard work that they're doing. It's a job that I know that I could never do. And so I want to make sure that that positivity is put into both our teachers, our students, our administrators every single day, so that they know that they have the power to make a difference by making the right decisions. And I think we can end some of that violence when they come to it with a positive attitude.
Wonderful. And Dr. Price, what would you put in your toolkit or your medical kit, if you will?
Thanks. In a nutshell, fairness and equity. I think if we can reshape the conversation and the focus that America takes to our citizens and our immigrants, and focus on taking care of the injustice, taking care of those social determinants of poor health outcomes and poor social outcomes, making sure that we address the ills within society that create the violence and the harm and the discord, I think things will fall into place by themselves. But this divisiveness that we have in America right now is very conducive to not only this coronavirus, but to each and every subsequent pandemic that comes into our society. And so I think if we reshape our focus and people believe that we truly are concerned about them as individuals, them as families, and them as communities, that we will be able to overcome anything that approaches us in our society.
Well, I think we have a wonderful toolkit to give people some resources for surviving. I again, as a father who has children who are being educated, and knowing firsthand how they are being challenged, I am very concerned. I don't want any of my children again being harmed, and I don't want them to harm anybody. And I am working very hard, and so we're looking forward to using some of these tools you have put into the toolkit for keeping our children safe and healthy. If I could add last one thing, I would say that I definitely would put into that toolkit something that Dr. Corley mentioned, and that is prayer. Every single day I pray for my children, and I pray for those people who are helping them, and as they go into their schools, because it's a real challenging time. As I was talking to one administrator just with yesterday, to have to. I remember going to one school we were visiting to think about changing school as we get ready for the fourth grade, and it was a school, and I just had my mask on. We were just going to different rooms, and I could just myself. I was getting short of breath just walking to different rooms. I can't imagine being an educator today, having to deal with, all these children, and also them having their mask on, and me having my mask on, and everybody having a mask on, and I definitely wear masks. I do, but I can only say that I can see the challenges, and I see, what seems to me that some people have this mask and have kind of translated it to mean, like a bandit. So it's a bandit mentality that they have incorporated, but by saying that they can then now hide themselves by these masks. And so I really appreciate that. I think we have our one of our board members who's come on to kind of give us a closing remarks. But I want to just say how I'm grateful to each and every one of you. And hopefully our board member, he will also recognize you and recognize our sponsors. Thank you so much, every one of you all, for your outstanding presentations. We have definitely gotten a toolkit that hopefully will help us to survive and thrive. And we look forward to you all participating in our upcoming events. So without any further ado, let me bring on our board member, Rufus Little. Rufus?
Good afternoon, everyone. Good afternoon.
We're not able to see you, sir.
Can you see me? I think this camera resolution is probably a little bad right now. My apologies. I was just going to say good afternoon, everyone. This has been an awesome afternoon of conversation, great debate around some really important and timely issues. As a parent of young people, conversations like these are so very important as we start to when we think about public health and what we need to do as a community to keep our young people safe. And parents are facing such difficult decisions. None of them are easy. So nuanced conversations like these, where we try to dig in and address as many questions and dispel any myths and really touch on everyone's concerns, are so important. So I want to thank all of our panelists, Dr. Corley, Dr. Bay, Attorney Frazier, Dr. Price, and of course, our host, Brother Talib Kareem, for everything that was offered here today. I think as a community, we need to keep the conversation going, and hopefully those who are out there in cyberspace and everywhere else who have been listening have been edified by the words that have been shared, and hopefully we're all smarter for the conversation that we've had, and we're looking forward to more of it. So thank you for that, and we encourage you to continue to support STEM4US and all of the outstanding programming that's being offered to the DMV community and beyond, thanks to cyberspace. We will look forward to connecting with you at all those events. Thank you.
Well, that has been a really welcomed voice from Rufus Little, a member of the STEM4US Board of Directors. We're very, very grateful for, again, all of the support that we've been given from Virginia State University, from Winsome Sears for Virginia Lieutenant Governor, from Tommy Thompson with the NetTech, from the W. Montague Cobb National Medical Association Health Institute, the National Bar Association's Health Law Section, and Abe Yoga. Very grateful for our sponsors and for our speakers. The Lieutenant Governor of Virginia, Dr. Robert Corley from Virginia State University, Dr. Winston Price from the W. Montague Cobb NMA Health Institute, Attorney Sharice Fraser from the National Bar Association's Health Law Section, Dr. Makita Bay from the Resilience Therapy Center. And it has been a great honor to participate in this conversation with them. We look forward to our upcoming event. Please stand by, check us out at www.stem4us.org. And in the meantime, please check out some of our sponsors whose contact information is in the information, and I'll basically allow them to be put on the air for a few minutes before we actually end the stream. So again, thank you so much, and we look forward to having you guys join us next time. Take care.